Hi, I'm Dr. Paul O'Malley with Great Oral Health, Inc. And I want to talk to you a little bit about the overall effects of what we've seen in our children, we've seen in ourselves, is ear, nose, and throat infections, the ENT, and how these sore throats come about and why they're all interconnected. So most of you out there know, if you're flying on an airplane, you have to pop your ears because the outside and inside pressure of the body changes and it gets affected in the ear, and we do that through our mouth. Everything's sort of connected through a nice pathway of sinuses and drainage pathways. In the morning when we wake up, sometimes people can have maybe their breath or their mouth doesn't taste very good. Some people have postnasal drip. All these things are interconnected and related. But what has been discovered is same way with the teeth. If the teeth have a certain plaque that builds up around them, if the plaque gets out of balance and more harmful bacteria overgrow and overtake the good bacteria, we can start getting cavities. We can start getting gum problems. The same way things happen in the ears, the nose, and the throat. Many of you listening out there watching this video presentation have children that went through many, many bouts of earaches, severe earaches. They're horribly painful for the kids. And then we go to the medical doctor, and their tool that they have as a solution is to prescribe antibiotics, which do work. But what happens is that then they've suppressed all the natural bacteria that build up along with the harmful ones that built up, and over time that can come back. So many times they go on this sort of a revolving door. So they're in with the antibiotics, then 6 months and they got another infection and another infection. So there should be maybe some other solutions out there, and in fact there are. And one of the interesting things is what we discovered with some oral probiotics is that they can have various strains can actually impart a certain type of immune improvement by actually putting some of the healthy good bacteria in at a higher amount. Or let's say someone came in and there was one study, it's a company out of New Zealand, and they isolated a certain type of bacteria strain in a young boy that never got sore throats. And they found he had a certain high number of this Streptococcus salivarius strain called Bliss K12. The Bliss is an acronym that stands for what that type of bacteria can do. It can actually, after you seed it into the mouth, etc., it has a natural capability in a Star Wars-like fashion to go out and laser light hit the harmful bacteria in its vicinity and sort of take them out as it's regrowing in its population. But just to go over that, I mean, there's a study here, an Italian study that they worked with 40 adults with a history of frequent strep throat infections and tonsillitis. And they were given the Bliss K12 strain. They were divided into two groups. So one group didn't have, they got like a placebo, and the other group got the actual Bliss K12 lozenge. And they followed them for 6 months, and after the 90-day treatment period, the oral probiotic group saw an 80% reduction in infections during the treatment period and a 60% reduction over the full 6 months. So while they were taking it, they really saw a reduction. After they stopped taking it, they still had an improvement by 60% for 6 months. Because what we know is that when you take oral probiotics, it takes a week or two for them to seed the area and start growing in a beneficial way. But once you stop within 3 weeks or so, it starts going back to its baseline. But interestingly enough, it still imparted a nice immunity for up to 6 months. So, there's many, many studies like this done on this aspect of how these frequent infections with ear, nose, and throat are happening. People are taking antibiotics. The physicians now, as a dentist myself, we're trying to prescribe less antibiotics because there's such things as superbugs, there's overgrowth of bacteria. We know all these things. So if there was a more viable alternative, and even if I have any MDs listening, they'd be interested to know this very, very effective treatment. And I want to let people know out there that if this balance goes out, which it is somewhat out, and apparently 98% of us, we don't have enough of these kind of healthy sore throat and strep throat fighting bacteria. If we took this preemptively and preventatively, or you start getting a bit of a sore throat and you take it, per this study, about 80% had less of that incident. From my observation, I've seen about 50% will not actually land a sore throat. The ears will clear up, everything within a couple of days. The other 50%, it seems to be less severe. So this is a viable alternative. Please check out oral probiotics and see what it can do for you and your family, and because this is a real unknown aspect of health care for the ear, nose, and throat area, and also for the oral cavity. Thank you.